Most wrist fractures are actually caused by relatively low energy mechanisms of injury, meaning that patients trip and they fall, they land on an outstretched hand, and in the process, something has to give. Occasionally that results in a wrist sprain, but it often can result in a wrist fracture. Wrist fractures are usually obvious to the patient because they result in a lot of pain, swelling, occasionally bruising, and in more severe fractures there'll be obvious deformity. In those patients, generally speaking, the standard of care is to fix it surgically in order to restore the patient's anatomy and also to ensure that they have good function in the longer term. Repairing a wrist fracture is generally performed with a surgical incision on the palm side of the wrist with placement of plates and screws that will hold those pieces of bone in the appropriate position so that they can heal in the position they were before they broke. The healing time after a wrist fracture, especially one that's repaired surgically, is generally in the order of 6 to 12 weeks. Repairing something surgically allows you to begin to move the patient earlier and try to avoid some of the complications of stiffness and pain that can result after a fracture. If you have the symptoms of a wrist fracture or a fracture of the elbow or shoulder after a fall or other injury, contact our office. We'll set you up with somebody to evaluate you. Make sure you get the care that you need.